Professor Rosenberg, how many people are affected by kidney disease worldwide, and how many require dialysis treatment or kidney transplantation to live?
We thought as three societies that it was very important to try and define the global impact of kidney diseases. And through a working group and review of as much data as we can, we came to consensus there are 850 million people worldwide with kidney disease, which really emphasizes what a public health emergency this is. In terms of dialysis, there's probably more than 3.9 million people on some form of renal kidney replacement therapy, whether it's dialysis or transplantation. And there's probably a larger group that doesn't have access to that kind of therapy.
Mm-hmm. Yeah, so Professor Jha, many million patients worldwide require renal replacement therapy, but as you pointed out, do not receive these treatments. Why is that, and what could be done to improve the situation?
So as Professor Rosenberg pointed out, almost as many people do not receive renal replacement therapy even though require it as they do. The reasons for this are multiple. One is, the most important of course, is socioeconomic reasons. Dialysis treatment is expensive, and many countries around the world cannot afford that, making that expense on a relatively small number of people compared to the population of the country who have this illness. The other thing that happens often in such situation is that people who are afflicted by this condition end up trying to access treatment using their personal resources. So they have to make a lot of out-of-pocket investment, which pushes a lot of people down into poverty and leads to really very poor outcomes as well.
Mm-hmm. Professor Zoccali, why are there so many people over a long period of time not aware of their impaired kidney function?
The reply to this question is simple, because the news that CKD and kidney disease in general are so spread in the general population is being considered information for nephrologists. So the information did not go out of the circle of the experts, and this now is intolerable because kidney disease are ascending the rank of mortality. And it is projected in 2040, kidney disease will be the fourth cause of mortality.
Mm-hmm. Okay, so then it's very important to protect kidney function. Professor Rosenberg, how can we do it? How can we protect the kidneys?
One of the key aspects is to be aware whether someone has kidney disease or not, because it tends to be a silent disease until it progresses. So awareness is key, and knowing what the risk factors for kidney diseases are, will help make people more aware. The two leading causes are diabetes and hypertension, so it's important for people to be screened for the kidney disease if they have those disorders. So awareness is number one. Number two is, if you're diagnosed with a kidney disease, there are therapies that can help slow progression of the kidney disease to keep someone off of renal replacement therapy for as long as possible. That includes diabetes control if someone's a diabetic, blood pressure control, use of specific blood pressure medicines, as well as emerging data that the type of medicine used to control diabetes is really important as well. So awareness and then slowing progression once you have disease.
Professor Zoccali, you already pointed out that it's not only the number of people living with kidney disease which is dramatic, but also their outcome. Can you explain this reality?
The reason of this is that kidney disease are a complex entity. In particular, chronic kidney disease is a multi-system disease, a systemic disease. When you have your kidney that don't function. Also your heart, your brain, your lung are affected. And therefore the complexity of disease increases the probabilities of death.
Professor Jha, we heard that chronic kidney disease is one of the most common diseases worldwide, but the public seems to be totally unaware of the extent of this health issue. What is the joint mission of ASN, ERA-EDTA, and ISN?
So thank you for that question. That's really very important. A recent bit of work which was done by some non-kidney disease specialists actually shows that kidney disease, out of all diseases that lead eventually to deaths, kidney disease is least covered in lay press and in even searches that people make on search engines these days compared to its contribution to the cause of death and disability. So that really underscores the importance of lack of awareness that Professor Rosenberg and Professor Zoccali already pointed out. So our three societies are working together to fill this gap, increase awareness, and one of the first things that was done was coming up with the number which was already mentioned. And this number is actually larger than the number of much more commonly recognized so-called killer conditions like diabetes, cancer, etc. So that itself is very important for advocacy. The other thing that the societies are doing together to work and improve the access of care to these people. So making sure that everyone who requires it has access to essential tests, has access to essential medicines, making these available to the people who live in the community in cheap forms, and thereby getting them to adopt these preventive measures early so that they don't develop advanced stages of kidney disease.
Okay, thank you very much, and we hope we can raise awareness.